Hello and welcome to Freedom from Fear, a German New Medicine podcast. I'm your host, Ashlee Newberry.
And I'm your other host, Abigail Puccioni. Please be aware that nothing discussed here on this podcast should be taken as medical advice.
Consult your trusted professionals and your own inner knowing before making any health decisions. Welcome back, everyone, to our Freedom from Fear podcast for episode 2. We will be diving into what is a paradigm and the paradigm shift going from Western medicine, which was a lot of my story. I left the nursing field 6 years ago and kind of skipped the holistic stuff and kind of went right into G&M. And Abigail will be sharing more about leaving the holistic realm and what that experience was like getting into G&M and how G&M is different than both the holistic world and Western medicine, and just really brings a lot of peace and freedom from a lot of the just perspectives of both the holistic world and Western medicine.
Yeah, hence the title of the podcast being Freedom from Fear. So yeah, I know that both Ashlee and I feel like on our social medias throw around the word paradigm an awful lot. And if you're somewhat new to G&M, you've probably heard this term thrown around, and some people might be like, okay, what the heck do you mean by paradigm? What's a paradigm shift? All this stuff. So we wanted to dive into a juicy conversation, if you will, on kind of exploring the different paradigms. And we're going to be talking about, paradigms related to health, right? So the conventional medicine paradigm, which is the most mainstream, of course, and then the holistic health paradigm, which is becoming more and more mainstream, honestly. I mean, the wellness industry, as we'll talk about, is, booming. And then the G&M paradigm and how that is different from the first two, and how the modern medicine paradigm and the holistic paradigm are actually way more similar than one might think. So yeah, that's what we're going to be diving into. So Ashlee, do you want to start us off with our dictionary definition of paradigm?
Yes.
We thought this would be important to include.
Yes, because especially like we talked in the first intro episode, German New Medicine has a lot of language around understanding the biology of the programs and stuff, and so we want to make sure that you understand also like what is a paradigm. So according to the internet, a paradigm is a set of theories that explains the way a particular subject is understood at a particular time. So to put that in even more basic terms, a paradigm is the way that you see things, right? The way that you are, it's a perspective, or your perception of any one particular subject. And in this case, since we're talking about health, the way that you see your body, your symptoms, your health, and how all of these things work together, and how, right, G&M is different, goes against the grain of Western medicine and holistic medicine. And so Abigail, if you want to talk about a little bit of your experience and kind of how Western medicine and holistic medicine are actually more similar than most of us have thought about or would like to believe, especially if you're in the holistic realm.
And I think also just to add on to that definition, like another way that I like to say it in very simple terms is, a paradigm is your framework, like, a framework for understanding the world around you. So some people use the term framework instead, which I like, but also, even simpler, just the lens through which you see the world. Imagine, changing out your prescription, contact lenses or whatever, and, it affects how you see the world around you, right? And so that's kind of, in the most simplistic way of understanding this, learning things like about G&M and learning G&M knowledge, it will affect the way that you see everything around you in terms of, health in the body and symptoms and everything. So Yeah, I think you should start, Ashlee, because let's unpack the, modern medicine paradigm first, which I know you have the most experience with. So, I mean, obviously, I do too. My dad's a doctor, a conventional doctor. I definitely grew up very firmly rooted in the conventional paradigm. I used to be extremely, hypochondriac, and
Mm,
definitely would go to the ER for like any little thing. So I definitely have my experience in the conventional realm, which I'll talk about. But since you are a registered nurse, why don't you talk a little bit about your journey in that paradigm and kind of like how you found GNM?
yeah, awesome. So we're going to actually go to pre-nurse Ashlee. I was a certified nurse's aide. Did that
Mhm.
throughout college when I was going to nursing school. And so I was like more of like a caregiver role where I'm helping elderly residents like go to the bathroom and get cleaned up and changed. And, so I wasn't passing the meds or, doing the medications or creams or
Mhm.
whatever kind of things the residents were prescribed. But I saw how much that all of these nursing home residents, when they're elderly, like usually the average range was 70 something to like 90s or 100. So,
Mhm.
they're getting up there. And
Yeah.
just how much kind of drama I would say was around, like I need to get these meds, and just how much fear there was about,
Yeah.
any symptom or any change or any, oh, I got this, rash on my arms. Like I had this
Mhm.
one resident that just had a, not going to say standard, but just consistent rash on his
Mhm.
forearms, on the top of his forearms, and we would have to like wrap his arms with like gauze and like salve
Mhm.
and stuff because it was just, he was in a lot of pain and it was
Yeah.
itchy. And um so like understanding GNM, I'm like, oh, it was like that was a separation conflict. And because it was
Yeah.
on the outside, he's like, wanting to like separate from other people and kind of like
Sure.
stand his ground. And but at that time I didn't really know GNM. I didn't know GNM yet. And
Mhm.
I was just doing my best to like support and take care of these people when, this is probably going to be the last place that they ever live. And
Mhm.
but it was hard, and I kept seeing, the same symptoms with people over and over and over again, and just the fear.
Yeah.
And we would put people in isolation and have to like gown up and stuff or wear like a mask to go in their room depending on, what they were like diagnosed with.
Mhm.
And I remember feeling like it was so hard for me to then connect with them when like you have this
Right.
extra, like you're wearing this extra thing on your body, and it was like, we're like taught to like, oh, be afraid of whatever germs that they have.
Right.
And
Right.
it was really dehumanizing to see the residents that I was taking care of in this way.
Mhm.
And it just kind of broke my heart because, and now knowing GNM, I like understand it, from a way different perspective.
Yeah.
Um, but it made it really hard to see them like from this more human perspective, because
Right.
you're kind of treating them as this thing that needs to be fixed, that there's something wrong, that there's something broken, that, and there's always, especially with elderly people, it seemed to be this drama about every single thing. It was like, oh, and then this happened, and then, and then I
Mhm.
had to go to the hospital for this. And it was hard because
Yeah.
I wanted to connect with these people from a human to human level.
Yeah.
And my role as a nurse's aide was, less medical and more of like the helper supporter, like
Mhm.
help them with activities of daily living, ADLs as we
Yeah.
call them. And so then when I moved into nursing, because I did work as a nurse at the nursing home for a few
Mhm.
months before I got my hospital job. And that was insane because you have like 20 patients, all the meds are crushed in
Mm.
applesauce or pudding, and like then a lot of them have like they need to get their blood sugar checked before meals and get their insulin, and
Right.
it was just so unsustainable and so like just gut wrenching because
Mm.
they also saw me as a nurse's aide, so they were like, "Oh, can you take me to the bathroom?" And like
Yeah.
I couldn't because I'm like, I have like 19 more patients and that's not my role anymore. So that was
Mhm.
also like a whole other thing to kind of go from the aide to the nurse role within the same facility where residents have
Mhm.
known me for years in this one role. Um, and then they're like, "Oh, why can't you do it now?"
Yeah.
And but that was rough, being in the nurse role at the nursing home because I felt like I couldn't take care of the residents at like in the way I wanted to because I just didn't have time.
Right. Right.
And it just it made it really challenging to support people in the way that I felt like they deserved.
Yeah.
And I couldn't do that. Like I didn't have the time, and then I would get behind on meds, and which was not good because then you can't really like recover from that if you keep
Yeah.
being behind. Um and then I was starting to work at the hospital doing my like training as a new nurse, and um I was going to a chiropractor office, and so I was already a little bit, I mean, I had my foot in both camps for a while. You know, both the holistic, like the chiropractor world, and then the nursing world as I was studying to be a nurse and then working
Yeah.
as a nurse at the hospital, which was very interesting and challenging because I felt like every
Mm.
day I went to work, I was kind of fighting myself in my head. So I'm like, oh,
Right.
I'm seeing these symptoms from a different perspective than what I was taught, but yet I can't voice this other opinion or this other perspective because I might get fired or, you know, like
Sure.
some negative consequence might happen. And I had just, you know, put all this money into college to go to school and be a nurse. And
Right.
so I also felt like, okay, I have this other information and was just starting to dip my toe into GNM. One of the chiropractors there, Melissa Sell, which I'm sure a lot of you probably know, she was actually my chiropractor back when I lived in Michigan. And so I'd been following her on social media,
Mm.
and she started talking a little bit about GNM and had made her um, one of her YouTube videos. And I was like, oh, this makes way more sense. I was like, oh,
Yes.
yeah, this is like, holy cow.
It kind of
um,
blows your mind a little bit. I'm curious though to ask about, you know, when you were working in the hospital and very much immersed in the conventional medicine world, did you ever notice that, you know, people were asking kind of the deeper questions, like the deeper why, like, okay, but why do I have this? And, you know, someone else has this. Like, did you ever see that questioning, or was it just purely symptom management, band-aid approach? We just want to make your symptoms go away, and kind of like whack-a-mole, you know, like as symptoms pop up, we just, you know, deal with it, right? But like not really looking at what's under the surface as far as like a root cause.
well, I worked in neuro, funny enough. So a lot of people were getting brain surgeries, which is like a
Mm,
major no-no now, understanding
yeah.
German new medicine. Um, and I guess what was like most interesting, I worked in neuro, so I worked with a lot of stroke patients and then seizure
Mhm.
patients.
Yeah.
So there was actually part of the floor I worked on that was dedicated to people's main symptom was seizures, and we would actually uh, set up their stay and hook them up to an EEG and try to induce seizures to see where it was coming from in the brain.
Okay.
And so
Interesting.
we would like sleep deprive, do flashing lights like
Mm,
strobe lights, and
Wow.
bring in their family member that would always trigger them.
Interesting.
So like in this very, safe environment,
Yeah.
try to bring on a seizure to see where it was coming from in the brain to help with like medication changes and or
Right.
possibly surgery, or there was like some implantation devices they would put in the brain to help stop the seizures,
Right.
so that people could have a more normal life and not always be afraid of having a seizure or something.
Sure. So do you find though that the focus was more on, okay, how do we, manage the situation, fix the seizures, help them have a more normal life versus understanding, okay, what is actually causing this and like why?
There was a little, like, one of the epilepsy doctors, or a couple of them, they were more focused on like kind of like what's underneath,
Mhm.
but not to the degree, I mean, not to the degree of GNM, of course, but not to the degree
Right.
of, okay, if we find the root cause and we can do something about it. It was still more about symptom management
Mhm.
and um like the cure was meds or surgery, like cut the part of the brain out that's causing the
Yeah.
seizure, or give them meds to stop the seizure. Like that was really the goal. Um and it was hard to be part of that, um
Yeah.
because even though they're in this quote safe environment,
Mhm.
um like trying to get them to have a seizure just feels kind of like against like the do no harm. I
Yeah.
mean, ultimately, like their focus was to then figure out med changes and stuff. And usually the
Right.
people that were coming in, were having an increase in seizures or different types of
Mhm.
seizures than they were before. So they wanted to figure out med stuff, so that they could, again, live a more normal life.
Sure. So what was
Um,
your transition like, once you found GNM, you found, Dr. Sell, she was your chiropractor. You started, watching her YouTube videos and were exposed to this idea. And then, you were talking about how it was kind of hard, like, okay, being in the nursing world and the conventional medicine world and kind of, describe when you reached, I guess, a breaking point, you could say, which you were like, okay, enough, like this is not in alignment anymore.
I probably reached that point a lot sooner than I actually made the decision to leave nursing. I know I
Okay.
did. Um, I
Sure.
I worked with Steve. Steve is Melissa's partner. I worked with both of them, like on and off for a few years,
Mhm.
and I think that I knew that as also nursing school was a lot different than actually practicing as a nurse, especially in the
Mhm.
hospital setting. Nursing school is a lot more holistic and more like education focused, and you kind of like support the patient with
Right.
like all things in life and diet and exercise, and not just like, this is your symptom, here's
Yeah.
your meds, which is kind of the hospital focus. It's
Sure.
just like,
Sure.
people are in some type of health
It's
crisis.
essentially like putting out fires,
Yeah, yep,
very much. Yeah.
exactly.
Mhm.
um and but I didn't know what to do with it at first, because I'm like, I'm learning this new way of seeing everything, seeing the world and symptoms and health, and
Mhm.
but I just went to school and paid all this money, and I'm just starting this new career, and so I was like, I'm not sure what to do with this information.
Right.
So I was kind of in like a, what do I do with this for
Limbo.
a couple years.
Yeah.
I stayed in nursing for 3 years. Also, that was when I was able to get all my retirement money from my company I worked for. So I literally quit a week after my 3-year mark.
Mm.
And but I still didn't know what to do after that.
Mhm.
Because I knew I wanted to do something with GNM, but I wasn't sure what that looked like. I've never
Right.
been an entrepreneur before having my coaching business, so it was like, I don't know what that looks like. And like, I don't, and, then obviously like our own conflicts come into play. Like, oh, am I good enough to like teach this or help people? Or, like, how would that look?
Right.
So a lot
Sure.
of those,
It's
limiting
scary.
beliefs came into
Yeah.
play.
Mm-hmm.
And when I left nursing, I got a lot of flack for it from my
Okay.
colleagues, from my family, from my friends. Um, it was just very shocking and very hard for me to deal with all of that when it was coming from all sides. Like, I felt like
Yeah.
no one really supported my decision to leave and to figure out, oh, what do I want to do? Who
Mm-hmm.
am I? Right? This is the identity conflict. Like, where do I fit in, and
Yeah.
what do I want to do that's like separate from this is what you should do. This is how you
Yeah.
should behave. This is how you should live. Like, oh, this is a good job
Mm-hmm.
security. You're helping people. And I'm just like, but I'm miserable and I don't see people getting better. This is not what I want to do. And I don't feel like I'm really helping people. Like, people are staying sick and
Yeah.
they're also not in a place to take personal responsibility and
Right.
actually like get better. But that was really hard when, yeah, my family, my friends, my
Yeah.
coworkers, like they were all just like, you are crazy. Why are you doing this?
Mm-hmm.
Like, what, like questioning, like, oh, what else? Like, what are you going to do now? And I'm like, I don't know. And they're like,
I don't
oh,
know.
like,
And I
what?
think that this is a really common thing though in both the medical mainstream model and the holistic realm. There's a lot of pushback sometimes for going against the grain in this way and for having these, beliefs that kind of very much challenge the modern medical industry and the holistic wellness industry, right? Their
Yep.
businesses, their, ways of making money. And people don't always like it. And especially I've noticed this a lot, people that have businesses, based, I see this, of course, I'm speaking from my experience in the holistic realm, but, when people have businesses based in some sort of like supplement company or wellness coaching business or whatever, helping people with detoxing or something, there's a lot of, pushback. And then at a larger systemic level, like with the modern medical industry, of course, there is huge incentive to push, prescription drugs and to keep things status quo and to kind of gatekeep
Yep.
the research, and, only people at the top institutions can do this. And, it's funded obviously by like big pharma and whatnot. And, most of the time. So without getting too off track, people, um, are very incentivized to remain in their current
Yep.
worldview. In addition to just, it's very uncomfortable to change. It's very hard to question beliefs that you've had your entire life. A lot of people I talk to, in their 20s, 30s, 40s, 50s, right? Like they have 20, 30, 40, 50 years, being entrenched, in very saturated in either conventional medicine or, holistic wellness. And if that's been your predominant paradigm and that's kind of the programming that you were, raised in, it's really hard and uncomfortable to question,
Mm,
your entire way of viewing health in the body, especially when it goes so against the mainstream, right? So that's
yeah.
like what we're going to talk about is unpacking, okay, what are the similarities and differences between these three paradigms? So, you shared a little bit about your journey. So I'll share about my journey with the holistic side of things, which I know you're obviously very familiar with the holistic realm, because I think probably a lot of people, clients that you work with are probably coming more from the holistic side of things, because I do find that a lot of people in the holistic realm have had to transition from the conventional world, right? So
Mm-hmm.
they've already gone through the process of going against the mainstream to a certain degree. So they're used to kind of questioning, the deeper why. Okay, well, why do I still have this chronic condition that no doctor can help me with? And, people feel
Yeah.
very gaslit by the medical world, right? Like I know this was my story. So after, I mean, I won't get into like all my symptoms or anything, but I started e-commerce lingerie business after university. I ended up moving to Europe and kind of running it from there. And while I was over there, I had a lot of just kind of, weird chronic health issues popping up left and right. I eventually actually had to close my business because I was so chronically ill. I had really bad chronic pain. It was just like my whole world was kind of falling apart around me. I felt like, what is so wrong with my body? Like, what's wrong with me? Like, I just got
Yeah.
super unlucky. And so I had this very deeply held belief that I was, messed up and that the world was out to get me. Everything was out to get me. If something, I actually had this belief, like really bad, if something bad is going to happen, it's going to happen to me. And that was my
Ah.
entire worldview, and I saw, some of the top specialists in the world for certain things. Like I was diagnosed with osteoporosis at a very young age. I was diagnosed with a genetic disorder, Ehlers-Danlos syndrome, which, the doctors attributed a lot of my chronic pain and other weird symptoms to, and I soon realized they really have no clue. Like they really don't, like they're just kind of, and I don't blame people in the medical realm at all, because I do think that most of them became doctors or nurses with very good intentions. I think a lot of them think that this is the best way to actually help people. So I do think that the individuals have very good intentions, but they're part of a larger system which profits off of your pain. They profit off of your symptoms. They
And
are
your fear.
right, and your fear. Yeah. But as I soon realized, and then that's how I got into integrative health. I decided I'm going to go through this certification program, the Integrative Health Practitioner Institute, so that I'm going to figure out how to heal myself, which you can see this is coming from a very, pure place. I was very, motivated, like, okay, doctors aren't helping me. The modern medical realm is not helping me.
Yeah.
They were more or less clueless, honestly. I mean, they could give you a diagnosis, but I tried so many different kinds of medications and most of them didn't even work. And like at one point I was addicted to pain meds. It was this whole thing. And so I entered into the holistic realm, okay, I'm going to take back control of my life. And I do think it helped to a certain extent, not because of the actual changes I made, but because of the mindset shift. Like I'm going to take back power over my life and my body, and I'm going to figure this out because I'm going to heal myself if no one else can.
Yep.
So, I go through this, practitioner, certification program. I did a bunch of different certifications in the integrative realm. And oh gosh, I went through all the things that, changing my diet, going gluten-free and dairy-free and thinking it was really about the food and all the toxins in the food. And people love to say how bad the food is in America, how much garbage we put in it. And I'm not necessarily arguing that point. But I thought that was at the root of my health symptoms. This is why I'm so messed up, is because of, again, external factors, blaming things outside of myself. It's the food, it's, and then I got really into like the mold, the chronic mold illness narrative, right? Where, you attribute pretty much any symptom to the mold or the parasite. So I was doing, oh my gosh, I was doing functional medicine, like liver cleanses and, liver detoxing. I was doing like daily saunas, my house was full of air filters and water filters and all the non-toxic things. I was terrified to eat anything that wasn't gluten and dairy-free and organic. And, tested for, heavy metals and mold. I did heavy metal detoxes. And this is the work I did with clients as well. I did the mold detoxing protocols and supplements. I did the parasite cleanses and all of that, if people are familiar with like cell core products, I mean, I was into all that stuff, right? And I started noticing with myself and, with my clients that some would have some improvement, but then other chronic symptoms would remain, or one chronic symptom would kind of go away, but then another would pop back up. And so it was like we were constantly on, kind of like playing whack-a-mole with symptoms, right? Like I do a parasite cleanse and then this gets better and then this gets worse. Or, oh, my favorite thing in the holistic wellness world is attributing every symptom to detoxing. I don't I don't know how much experience you have with this, but it is wild how people like how I used to be, other like integrative health practitioners and holistic wellness practitioners, they'll be like, oh, well, if you're detoxing and you have all these symptoms, that's totally normal because you're detoxing, you know?
Yep.
And so everything kind of got swept under the rug and categorized as like, oh, that's just a detox symptom. So, you know, clients would tell me like, well, I feel horrible after this protocol. Like, I don't feel any better. I feel worse. And I'd be like, well, that's great because you're just detoxing, you know?
Yep.
So, and I do want to say, obviously, some people do have great success with this stuff because, you know, they believe in it. I think
Yep.
that they're taking control of their health. They're investing money into themselves, you know, revaluing themselves. They're, you know, really taking a lot of time and effort and with the intention of taking their health and their power back into their own hands. You know, this is what they think when they enter the holistic realm. And I can tell you, most wellness practitioners out there in the holistic world also have great intentions. You know, they really do think that they're helping people, and I'm sure that they are helping people to a certain extent. We hope you enjoyed today's conversation. We appreciate you being here.
If you would like some additional support in navigating your health symptoms, we both provide coaching services from a German New Medicine perspective.
Our Instagram handles and personal websites are linked in the podcast description.